Welcome to day 2 of the 2022 Utah Peer Conference. My name is Brent Kelsey. I'm the Assistant Director of the newly formed Division of Integrated Healthcare within the newly formed Department of Health and Human Services. I'm also the Office Director for the Office of Substance Use and Mental Health. It's my honor to speak to you for a few minutes today. The first thing I want to say is thank you for taking the time to attend this event. Peer support is critical to the health and well-being of our community. I'm convinced that a tremendous part of the solution that we're looking for to resolve the substance use disorder and mental health crisis in this country is going to come from peer support. You provide support to people who are often experiencing the worst moments of their lives. You share your knowledge, you give emotional support, practical help, and sometimes you're just a person they can talk with. By sharing your life experience with others, you reduce stigma, create broader understanding, and help people find their way to health and recovery. I'm glad that you're participating in this ongoing training. Peer support specialists are individuals who use their lived experience in recovery from mental illness and or substance use disorder, in addition to skills learned in a formal training to deliver services promoting recovery and resiliency. I've needed some resiliency this morning. You've needed some resiliency this morning as we're trying to bounce back from my misunderstanding. So I appreciate your willingness to work with me on that. Perhaps I think the biggest benefit that I see with peer support is that it reduces stigma. And stigma is a huge barrier to helping people find the services and supports they need to overcome substance use disorder and mental illness. And in fact, if you look at one of the studies that I talk about a lot when I talk to groups, is a study about stigma from the World Health Organization. And it looked at the most stigmatized social problems in the world in 14 countries. And they found that drug addiction was the #1 ranked stigmatized disease or situation, and alcohol addiction was ranked #4. This stigma prevents people from getting the care they need. We often talk about the treatment gap, and it's true. In this country, only about 1 in 10 individuals with a diagnosed substance use disorder are in a formalized treatment program. And so many people see the solution as, well, what we need to do is build more treatment. And we do to some extent. But the bigger problem, I think, for many of us is that individuals with substance use disorder or mental illness often don't perceive that they would benefit or that they need formalized treatment services. And a lot of that's due to stigma. So SAMHSA did a survey about 5 years ago, and they found that of the 20 million or so individuals in this country who need treatment, 18.4 million did not perceive that they needed treatment. By sharing your stories, by sharing your experiences, by engaging with people in a human way, you break down that stigma and you make it possible for people to get the services that they need. I'm a big fan of the SAMHSA definition of recovery, which says that it's a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. I think it's also important to remember that recovery emerges from hope, and that there's not just one way that recovery occurs. Recovery occurs in many ways. When I think about recovery, I also think about how SAMHSA defined the 4 major dimensions. And I say this to my staff a lot: health, home, purpose, and community. And if you think about it, that's really what we're all striving for. We all want to be healthy. We all want to live in a place that we can make our own, that is filled with the things that we love, and brings us peace and contentment. We want some type of purpose, whether that's a job that we love or an educational opportunity or a role in the community. We want to do something with our time that we feel like is meaningful. And then community. We want to feel connected to people. I think that it's interesting when I think about addiction and mental illness. I often think about pain and the suffering that people go through while they're struggling with symptomology related to those diseases. When I think about recovery, I think about connection, because I think that really is the solution for so many people. If people can find a community that supports them while they navigate the system and their response to different interventions, it's a whole lot easier for people. So I just want to say thank you for what you do. I hope that the day proceeds from here with less technical problems. And once again, I apologize for that. But I also want you to know that now I owe you one. And so if you stuck with this, if you have ideas about how we could improve the peer support certification that my office administers, or if you have ideas about what we could do to improve the treatment system, I want to hear from you. And because you suffered a little bit this morning because of my mistake, I owe you. So feel free to reach out. Let's talk. Let's continue this conversation in a way that improves the quality of life for everyone here in the state of Utah. So thank you. And with that, I'll turn it back to you, Javier.